fireman for 30 plus years, and then a carpenter. So I've been on my feet my whole life pretty much. I didn't spend a lot of time sitting, behind the desk or anything. So, yeah. Right, Liv?
I'm a nurse, yeah. I was a surgery oncology nurse for 25 years. Yeah. So.
She's my nurse now, private nurse. That's good.
That's good.
Pickleball. I think that was the key, wasn't it?
Yes, that was the straw that broke the camel's back.
Like I used to do a lot of golfing and stuff like that, and then we got into this pickleball game, and that's, it's a little more, what do you call that, impact sport, on the knees and stuff, so I think that's what put it over the edge. Yeah, well, we played tournaments, and we would travel around playing different areas and stuff.
And he's got a history of arthritis anyway, so I think this just exacerbated the process.
We just know that it's not something we want to wait around to have fixed in Canada, because it takes 2 years basically to get in to see a surgeon. So, and it's, they don't consider it emergency surgery; it's elective surgery. So they're only allowed so much, I guess, operating time every week. The surgeons.
And there's a process. They want you to try all other options before they resort to
surgery. You gotta go through the different shots, the steroids, the Synvisc, I've got braces for both knees. But it's just not something you can go forward with, and I can't golf with that, I can't hike with that, so I needed to get them fixed. And being 65 years old, I want to get it fixed now. Well, let's take some x-rays. We went and we got x-rays done, and then the first thing they want to try is some topical cream, maybe take the arthritis away, try some leaves. After that we went to cortisone shots. We had a cortisone shot in the knees, and that worked. First time, the second time a little less. Well, let's try the Synvisc, which is the next step after that, which is kind of a lubricant. They inject between the two bones there, and then we got the braces. They make a molding of your leg, and then they use a computer to basically draw this leg out on a graph, and they make a brace that's specifically made for each leg. It takes the weight off of the bones.
You see them in pain and there's nothing you can do, and coming from a healthcare background, we want to alleviate pain, and when you can't do that, it's very difficult to watch and to try to make them comfortable, but knowing the disease process as it is, there's really nothing you can do, so you just gotta watch. And I'm just so looking forward to him being able to...
Well, we do things together.
Yeah.
We want to be able to, play together, golf together, bike together, hike together. That's what we do. So right now, it's a one-man show kind of thing. I watch.
Yeah, and it's so sad to leave to go and play or something and see him sitting there watching, just wanting to go, but no, he can't go because he's too sore. So, yeah. It'll be good. I think he too hates to say no. Like, let's go for a hike, let's go for a bike. And for him to say no, that's hard because he would love to, but he has to say no because the pain is what drives his decisions now, right? Yeah.
Got online, started Googling, checked everywhere from Lithuania to India to Cayman Islands.
Even in Canada, we went to Quebec, or we had investigated that because there's a place there where they do private, but and we still chose here.
Yeah, Phoenix. I came down a couple of weeks ago. I put together a package. I had my x-rays put on a CD disc, and then I had my blood work and my medical history and everything. I had a nice little package, and I distributed it around to different clinics in Arizona, and I dropped one off here just with Darren, and this is what we decided. I mean, the doctor called me up one night at home. It was like,
After hours.
yeah, like 8 o'clock at night, and we talked for about an hour on the phone. Just he wanted to know what was going on, what I hoped to gain by the surgery. You know, what I was looking forward to do moving on, and you know, he was just very interested. He told me about himself, and it seems like he's very caring, and you know,
Yeah.
just wants to know about his patients, I guess. I told him what I had, my X-rays and stuff, and I'd like to, you know, send them down there, and I did. I sent them. We scanned them, right?
Yeah.
And we sent them down here, and they had a look at them, and after the doctor had looked at them, he gave me the phone call, and we talked for, you know, like I said, an hour or so. And I was coming to Phoenix anyway, so I drove through here, and I dropped off the actual disc with my X-rays and stuff on it, and my like my blood work I'd had all done, and my medical history, and the ECG, and all that stuff that they needed. They didn't have to do prior to me having. So when I got here, I guess Thursday night, right? We went out for dinner. Next day, an hour before the surgery, they did a little prep, you know, give me the IV, and
You were able to eat, able to drink up until what, noon, 11:30?
Yeah.
Noon?
and then at 3 o'clock we went into surgery. Like I said, at 6 o'clock I'm walking up the steps here. 6:30, I guess it was. Yeah, and the way he does it with like the blocker and the was it propofol?
Yeah.
You know, instead of doing a spinal or a total anesthesia where they knock you out and airway you,
Yeah.
intubate you, and when you come out of this, you're like, you know,
You have your wits, yeah. You're
That's
not
it.
drugged.
an hour later I was walking up the steps.
And no narcotics in the OR is amazing. That's an amazing thing. You know, that's what causes a lot of trouble. So that's good. Take that out of the equation.
And that's, you know, that's worth mentioning too, that, you know, what a great facility he's got here. MRI, X-ray,
Yeah.
this suite that you can stay in for a few days if
If you're out of town.
if you're out of town to come in here. He's got it all right here. You don't have to, you know, the physio downstairs, you
Yeah.
just,
They
So
never
one
leave.
package.
Yeah, they never leave you fend on your own. They're there all the way, every step of the way with you. You tell them what you need, and they make it happen. It's just amazing, really.
Oh, do it.
Yeah.
Do it for sure. Like you're wasting your life away.
That's right.
If you know, like I could be back in Calgary looking out the window at the snow right now, and waiting for a couple of years to be able to do something.
And like you say, getting less healthy, less active, more overweight, more depressed, like those are not good things to have when you're going into surgery next
Yeah.
time in 2 years. Like those can, you know, or just increase your risk.
I mean, certainly you have to go through the process. You have to try the shots, the Sindiscs, you know, you've got to try that, see if any of it helps, if it gives you any relief. Well, you know, obviously if total knee replacement is I think the last option, but it's a good option. You know, it's a good option if you can get back to being active and get a quality of life back. It's definitely money well spent, I
Yeah,
think.
absolutely.